Plastic, episode number 3. I have Alex here, and he's going to tell us his stories of his plastic surgeries that he's had.
Well, thanks for having me. I'm glad to have the opportunity to talk about this. I've had many surgeries, and mainly around my abdomen. I was very heavy, and I lost a significant amount of weight in my early 20s, and I was so excited to go get a tummy tuck. I saved up a lot of money, and I found a surgeon through a friend. I was referred to this guy under the impression that he'd done a lot of work on my girlfriend, and so I scheduled an appointment, and away I went. So all was really good. I went to the consult, and he said I had very realistic expectations, and we scheduled a date. And I remember the day off, we went to the surgery center on Armenia in Florida, Tampa, and it was really uncomfortable. There were so many surgeons there and patients, and it was kind of a weird experience. But I got into my gown and drawn on, and away we went. And I woke up, and it was done, and I had a new tummy. And
how'd you feel when you woke up? Like, did you feel like everything was okay at that point, or?
Yeah, I was just kind of pleasantly numb and excited and riding the high of plastic surgery, because anybody that's had plastic surgery there's some endorphins and excitement, and it's a thing. Mm-hmm. I would say within that first few days, my friends kind of noticed that things looked a little bit funny, and I remember being very afraid to take a shower. I felt like everything inside of me would fall out in the bathtub when I got into the shower. So I remember my friend mentioning that my belly button looked a little high and misshapen, and I looked in the mirror and I didn't want to believe it, so I said, no, it's fine, it's going to heal. And I went to my post-op appointment, and that's what the surgeon said: everything's fine, give it 6 months to settle, and it's going to get better and better. And
how far out from your surgery was your post-op?
Maybe a week.
Okay.
It wasn't a long period of time, but this was many years ago.
Okay.
So I don't remember specifics. But he said no. He reassured me everything was going to be fine. My belly button would be great. Everything was normal, and that's what the doctor said. So I was 24 years old. Okay. Well, as time progressed, maybe a month or what have you, it just looked weird. The scar was healing in a weird way. It was very wide. It had a weird shape. The edges were scalloped. The belly button was very narrow. It was sort of misshapen, long, and very high up on my abdomen. And so I started, kind of reaching out to the surgeon, and he just kept saying everything's fine, everything's normal, just give it a year, it'll settle. And I started to get a little bit upset, and so I reached out again. He stopped returning my phone calls.
Was he seeing you this whole time? Were you going to his office, or this is just all telecommunication?
No, this was all in person. So there were probably maybe three visits. I don't remember specifics, but it was a long time ago. I just remember I wasn't happy, and I felt like I'd saved up all this money, and at 24 years old, I still wasn't comfortable taking my shirt off in public.
Yeah.
And I'd lost a lot of weight. I had all this skin and classic. And I started to notice I had these bubbles on the sides, where my hips are. And then the belly button was too high. The scar was probably, this wide. It looked kind of gross. And I just remember feeling completely deflated, betrayed, disheartened. And I didn't know what to do. I didn't know who to turn to. I did find out that the friend that referred me was just trying to get business for her husband's friend, and had never actually seen this surgeon in a professional capacity.
The surgeon was her husband's friend?
Correct.
Okay.
Yeah, and that really hurt, because I trusted this referral, but again, I was young and I didn't inquire further. I sought out legal advice, and if anybody's ever tried to seek legal advice for medical stuff, unless you're missing an arm or dead, nobody wants to talk to you. And
you have to have permanent damage, basically.
Yeah, it was awful. So I was on a mission. I was absolutely gonna try and get this guy to fix it. I was so hurt. He wouldn't even talk to me. And finally, one attorney said, look, if you can find another plastic surgeon to specifically state that he messed up or did something wrong.
So that's not the standard of care, basically?
Correct. He would talk to me, and you can't do that. Nobody would help. So I learned to live with it. I was very disheartened. I felt disfigured, misshapen. And then a few years later, I went to a Botox party, and I met this amazing woman. Her name was Dr. Barone in Tampa. And she did my Botox, and we talked about it. She was the first surgeon that I'd experienced that was willing to have a really human conversation. It was almost like a therapy session. I remember sitting in her office for over an hour, and it was so healing. And she kind of said, look, at this point you're going to be sort of like the Mona Lisa, never really finished. Mm-hmm. And you're going to have to learn when enough is enough, and I'll help you on your journey as best I can. And she did. She did some liposuction under a local anesthetic in her office, and she reduced the bumps on my hips, and that was a weird process. I don't advise doing liposuction while awake. I had to stand up and get checked, and I didn't love it, but she was great, and what she did was great. Later on, she moved away, and I needed a scar revision because the scar was about 2 inches wide and not very attractive.
Was there any loose skin there at this point, or was everything...
There wasn't loose skin. It was a little soft on the sides, that love handle area, but mm-hmm. The front was tight. It was just a big scar, and I remember having kind of a vertical scar, like a cross, right above the pubic bone. So I searched, and I found this surgeon who was amazing. He did the best work. He was a mature man, and he worked with a friend of mine. And I went and consulted with him, and he said, this is what we're going to do, a revision, some liposuction. And it was an amazing experience. The place I went to was a private surgery center, so I had my own nurse. I had this whole team of people taking care of me, and he did beautiful work. He made me feel human and pretty and feel good in my body, and it was great. So we did a complete tummy tuck scar revision. We extended the incision to remove the area on the hips, and we did some lipo on the sides, and the scar is a lot better. It's very thin. There is some permanent scar tissue in there, and it's not quite right because it wasn't right in the beginning, but so much better, livable.
That's awesome.
And then I gained some weight years later, and life went on, and everything's been good. And he did pass away a few years ago, so then I decided I wanted to get a Brazilian butt lift. I wanted to be snatched and perky and bubbly, and mm-hmm. started looking for a new surgeon, and I came across Dr. Watt in Tampa mm-hmm. through several referrals, and people love him, including one of my friends who's an anesthesiologist. She personally recommended him. I went to the consult. He was great, answered all my questions. I felt really comfortable, confident.
What kind of questions did you have for him?
Is it safe to do lipo when you've had so much done? What results to expect? Am I being a little crazy or too extra in wanting this done? What can I expect from a result? What is realistic versus, the fantasies that I've created in my head? And he was very down to earth and confident, and took the time to educate me, and it felt good. The office staff was amazing. The place was beautiful, and I went and had it done there. And again, it was a small operation. I felt like I had a whole surgery staff just for me.
Was it a surgery center, or it was in his office?
It was in his office, but it's like a tiny hospital in his large building. Mm-hmm. So it's kind of a big building. The surgery center is small, but it felt like once you go through the doors, you're in this tiny hospital suite. All the things you'd expect to see in a surgery center. Mm-hmm. And it was incredible, and I've been really happy with that.
When you woke up from your anesthesia, did you feel like you were being rushed out of there, or were you allowed to recover there? How did that work?
No, not at all. They were great.
Awesome.
They were really, really good. You know, that's funny you mentioned that. The very first time we talked, it was like, you gotta go. They were like pushing me out the door. When I did the in-office procedure, that was different because I was awake through it, you know, and somebody I think was there waiting for me.
It's not the same recovery.
No.
Yeah.
And then when I had the full scar revision, I mean, I felt like I was in a private hospital. I felt like a movie star.
Yeah.
I had my own nurse give me crackers and ginger ale, and whenever you're ready, you know, that was such a beautiful experience. Dr. Watt was somewhere in the middle.
Okay.
You know, it was nice once I was safe, and, you know, when you're ready, you can go.
Okay.
I never felt rushed, you know.
That's awesome.
So it was a great experience with him. Overall, I feel like I've done a lot of stuff. I have some other things that I'm thinking about doing, and you know.
Would you do it with Dr. Watt again? Would you choose him as your next surgeon?
Absolutely, yeah.
Awesome.
You know,
that says a lot about a surgeon when you would
he's great.
choose them again.
I think he's great. I mean, he's booked out. People love him. It's a family business. He's got the right education, the correct credentials. I feel like he cares about me as a patient. I feel like he stands behind a quality of work. I don't know. I thought that was a really fantastic experience.
That's amazing. What other procedures are you thinking about?
I'm thinking about a little bit of a skin removal surgery. You know,
Okay.
those love handles are still a bit off.
Okay.
But I'm debating if I should really do that or just kind of learn to accept myself as I am today.
Yeah. I mean, that's a very personal, big decision, and I'm sure that you'll make the right decision for you.
Absolutely.
So Alex's career, he's a hairstylist. What was the recovery like from that? How long did you wait till you went back to work?
You know, so I think the longest out of any of the surgeries I waited was 4 days.
Really?
Yeah.
Oh, wow.
Which was not recommended. I just really like what I do, so I wrapped myself up and made it work. The last one, the lipo and such with Dr. Watt was the easiest. You know, when you're removing skin, it's a little harder, especially standing up and feeling tight. When I was 24, for the first one, I was teaching beauty school.
Oh, wow.
And I think it was maybe 3 or 4 days after. I don't even remember how I got to the beauty school. I just remember being very white and a little sweaty, and they looked at me and said, "Go home. Why are you here?" So I think I took a couple more days on the weekend and then started fresh. And then the other stuff, maybe 3 or 4 days. You know, it's hard to take time away from clients, and I love what I do. I did tear a stitch on that revision and had to go in and have my abdomen lanced with the big scary needle because I had to come in and do a blow dry for one of my little old ladies. I definitely regret that in hindsight, but at the time it didn't seem crazy.
Did you wear binders? What was your surgical garment like?
So they've all been relatively similar. Different binders. I've had like high-rise, like Lady Gaga underwear that zip up. I've worn a full bodysuit from the knees to the shoulders. I've done foam pads and wraps, and over the course of 13 years, I've had a bit of everything.
With your BBL, did you do the faja?
I did the faja.
Okay. How long did you wear that for?
6 months.
Wow. Almost 6 months.
Yeah,
wow.
The whole time, foam boards. I took it very seriously, and I started with an extra large and went all the way down to a medium.
That's awesome.
So, like, maybe every 6 weeks I'd get a new one and smaller size.
Just keep going down from there.
Mm-hmm.
If you had any advice to offer people when they're getting plastic surgery, what would be your number one advice?
I think you need to do some soul searching and think about how you expect this to affect your life, and make sure you're doing it for the right reasons. Self-love is really important. I think I was doing surgery for validation from other people instead of learning to love myself. And
That's great advice.
I do like plastic surgery. I think it's important to feel good in your skin, and I think there are things that plastic surgeons can do to help us. I think, myself included, people can take it a bit too far.
Yeah.
And that's why I said, you know, earlier with this next surgery I've been thinking about, I'm kind of on the fence. You know, is it time to just let it be and learn to accept myself the way I am? Or do I really want to undergo removing a bit of skin in the name of vanity and a better silhouette?
Awesome. Thank you so much. I really appreciate you appearing on the show.
Yeah, I love
Appreciate
this,
it.
and I hope people get something out of it.
I'm sure somebody will. Thank you.